Let's talk about the overview of myocardial infarction or MI. What is myocardium? It is a muscle of the heart that helps to pump blood to the body. While infarction means obstruction of the blood supply to an organ or region of tissue that causing death of the tissue or muscle. Myocardial infarction, also known as MI or cardiac arrest, is only one of the types of several heart diseases leading to cardiac arrest. Have you ever wondered what exactly happens during a myocardial infarction, commonly known as a heart attack? It's a health event that abruptly interrupts thousands of lives each day, and it's as much about the people it touches as it is about the medical condition itself. So, today, I'm going to be talking about myocardial infarction, aiming to humanize this medical issue and help you understand its gravity. At its core, myocardial infarction is a condition where the heart muscle doesn't receive enough oxygen-rich blood due to a blockage in the coronary arteries. MI is the leading cause of death to people who seems fine at a moment then dead in a minute afterwards. This situation can quickly become life-threatening. But beyond the clinical definition, it's crucial to recognize how heart attacks can upend lives, affecting not just the individuals but their loved ones as well. It's a moment where time and action are of the essence. In the midst of the numbers and statistics, personal stories and experiences often get lost. I'm here to help you sift through the clinical jargon and get to the heart of the matter, no pun intended. Misconceptions abound, like the idea that heart attacks are sudden, dramatic events. In reality, the signs can be subtle and easy to miss, which is why understanding and recognizing them is paramount to saving lives. Unfortunately, movies and television have done us a disservice, portraying heart attacks as always being loud, clutch-the-chest moments. The truth is, myocardial infarction symptoms can sometimes whisper before they shout. You're going to find out about the various signals our bodies send us, signals that we shouldn't ignore. By the end of this section, I hope you'll have a deeper grasp of what myocardial infarction really means for those who experience it. And as we transition to the next section, we'll focus on those early whispering signs that could, quite literally, save a life. I'm going to walk you through some early signs of myocardial infarction that often go unnoticed. You're going to find out about more than just textbook symptoms. It's about the subtle signals your body sends that could mean your heart is in trouble. Chest discomfort is often misunderstood. It might not always feel like the elephant on the chest we hear about. For some, it's a nagging sensation or mild pain that comes and goes. You might mistake it for indigestion or muscle strain. If climbing stairs or walking a block leaves you unusually short of breath, it could be more than being out of shape. Your heart might be struggling to pump effectively, especially if this is a new symptom. Another sign that's easy to dismiss is unusual fatigue. If you are suddenly exhausted by activities that were once routine, it's time to listen to your body. Catching these signs can lead to early intervention, which can significantly improve outcomes. So choose something that resonates with you, whether that's scheduling a doctor's appointment when something feels off or discussing these signs with loved ones, and take action. Imagine this: you're having a typical day and a sudden sharp pain clenches your chest. You might think, is this a heart attack? Understanding the clear signs of a myocardial infarction can help you react swiftly and save your life or that of a loved one. But it's not just pain, it's a discomfort that can feel like unbearable pressure, squeezing, or fullness. Sometimes, though, the chest isn't the only area that cries out during a heart attack. Pain can radiate, sending alarming signals to the neck, jaw, back, or even arms. It's your body telling you that your heart muscle is not getting enough oxygen-rich blood. In the mix, you may experience cold sweats or suddenly feel dizzy out of the blue. And while it might seem unrelated, nausea or vomiting can accompany a myocardial infarction, especially in women. Never brush it off as a stomach bug if you're also experiencing other heart attack symptoms. Alarming? Yes, but also a trigger for immediate action. Calling emergency services could be the most vital decision you make at this moment. When it comes to myocardial infarction, not everyone's story is the same. It's crucial to recognize that symptoms can vary significantly from one person to the next, influenced by factors such as gender, age, and underlying health conditions. Research demonstrates that women often experience different symptoms than men. A woman's myocardial infarction might be announced by intense fatigue, sleep disturbances, or even jaw pain, rather than the classic chest pain. It's vital to acknowledge these differences because they can affect timely diagnosis and treatment. As we get older, our body's signals become less predictable. Individuals with diabetes face a unique challenge since nerve damage caused by high blood sugar levels can dull the pain sensation, leading to a silent myocardial infarction. It's not uncommon for a diabetic to have had a heart attack without even realizing it. By revealing and understanding these variations through patient stories, we highlight why personalized attention in medical care is so essential. Each symptom, no matter how atypical, should be investigated with the possibility of a heart attack in mind, especially when the individual has known risk factors. What you do next is crucial, and I'm here to help you understand the immediate actions to take. If you suspect a heart attack, choosing to act quickly can be life-saving. If something feels seriously off, it's better to be safe and seek medical help immediately. Let's break down these first steps. Ensure the person is seated comfortably, initiate an emergency call, and if you're trained, be prepared to perform CPR. Remember, acting fast is the name of the game here. Knowing the basics of CPR and having quick access to an automated external defibrillator, AED, can make all the difference. Don't second guess, dial your local emergency number straight away if you see heart attack symptoms. The emergency operators can guide you through necessary steps, including how to perform CPR if needed. A heart attack experience reminds us that we're all vulnerable. I'm not just talking about getting through a myocardial infarction, I'm also talking about stopping one from happening in the first place. Prevention is always better than cure, and that's especially true when it comes to your heart. One of the most powerful tools at your disposal is education. Know the risk factors, which include high blood pressure, high cholesterol, obesity, and smoking, among others. Choose something that resonates with you, whether it's incorporating more vegetables into your diet, taking daily walks, or finding ways to de-stress. Making even small changes now can lead to big improvements in your heart health. I'm here to help you take that first step. Thank you for watching. Please like and subscribe below.